On from this Enyobeni Tavern tragedy, there are concerns that are continuing to be raised as to the number of underage teenagers allowed at the venue. But this problem is not isolated into the Eastern Cape. It seems to be a systemic problem in our country. The abuse of drugs, alcohol, teenage pregnancies, and gender-based violence continues to plague our country. The City of Tshwane today hosted what it called a youth and adolescents healthy lifestyle outreach program in Soshanguve, just north of Pretoria, Tshwane. Melanie Langeveldt is from the primary healthcare program in Tshwane, joining us now to talk about this. Good afternoon, Ms. Langeveldt. Thank you very much for your time. First up, just tell us what message were you trying to convey to the young people of Soshanguve today through this program, this outreach program you did today in Soshanguve?
Good afternoon. Thank you for the opportunity. Our main focus today was to indicate to the youth and the adolescents what services is available to them in the community where they live. We feel often community members are faced with challenges, whether it be a health or a social challenge, and they don't know where to access services or where to get assistance. So the main focus today was to get together a whole group of stakeholders from various government organizations as well as non-government organizations to give information to the community if they are faced with a problem, that they know where do I access assistance in the community where I live free of charge. That was our biggest focus today.
Yeah, on the back of what we saw happen in East London at Scenery Park last weekend, where 21 teenagers, adolescents, have died, you also shared issues around the use of drug and alcohol, I understand, and the damage that can be done. What was the focus there? What was the message around that as an example?
Well, today our focus was firstly on assisting youth, adolescents, also teachers, educators, and the parents of the youth and the adolescents, assisting them on how to take good health decisions. And if they are in trouble and they have taken some bad decisions, where they need to access assistance. So part of the people and the service providers that exhibited today included organizations that give assistance with problems like drug and substance abuse, alcohol abuse, assistance with mental illnesses, so that people, if they need assistance, know where do I go. And of course, a lot of health information was given so that the youth could access good information from solid health professionals and not be reliant on some of the social media that is going around.
Yeah, what about parents? I mean, when we look at what happens around, sometimes we say, where are the parents? The parents must be involved. You said one of the main aims today was also to share with the parents. I mean, were they really participating today?
Yes, we are very happy with the outcome today. There were several educators and several parents that came to the event. Part of the event was also a walkabout with exhibitions, and we saw a lot of adults coming and engaging with the health professionals at the exhibition stands, taking information sheets that they can use in the future should they need to contact any of the organizations. And that was actually our main aim today. To set out the word that help is available within your community. But we often find that people don't know how to access all the services that is already available. And we're hoping that after today, especially the community in that area, will have a much better idea of where to turn to when they are in trouble.
Are you planning to take this outreach program elsewhere? I mean, the City of Tshwane is a big area.
Yes, that is correct. Today was only the first of these events that we've planned, and we've started at Region 1, but we are definitely taking it to the other regions in Tshwane. We will first focus on Region 1 with a very large population, and then we will move to Regions 3 and 6, but eventually we plan to have this all over Tshwane so that all communities can benefit. Specifically, because we are targeting the services that is available in a geographical area, because we want to make an impact and really give practical assistance to our community members that they can easily access also in future.
Thank you very much for your time this afternoon on eNCA. That's Melanie Langeveldt. She's, of course, from the Primary Healthcare Unit at the City of Tshwane.